Many Americans are on the move this summer, taking trips, entertaining and socializing, but it comes at a time of an uptick in new coronavirus infections, which experts believe may be the early arrival of a summer wave.
It will take a while to ramp things back up if this virus finds a way to mutate and become much more virulent, that is, can make us much more sick, can transmit much better. If the virus it changes in that way, we're going to see a lot of people be very sick and die.
The potential COVID surge comes as a more infectious set of coronavirus subvariants, dubbed FLiRT, has now become the most dominant strain in the US. It makes up more than half of all infections in the past 2 weeks, up from just 20% in April. For the most vulnerable age group, 65 and older, updated vaccines can still be life-saving. But in California, only 36% of seniors received the jab since it became available last September.
It's really baffling. Age leads to our immune systems not being as robust, and if we get infected, this gives advantage to the virus. So it's striking that we see well less than half of the senior population in this country to not take advantage of something that's so easy to do to protect themselves.
An estimated 2,000 people died from COVID in April, less than half of what it was last year. But researchers say the numbers can be misleading.
It took us a long time to really ramp up to get really good data on how many people are infected, how many people are hospitalized, how many people are dying. California no longer reports hospitalizations. It's striking how we've just backed off from all of this. And it's not because people don't recognize that we should be doing it, it's because of the lack of funding for it.
Priorities seem to have changed for U.S. health officials as this season is shaping up to be the first COVID wave with little federal pressure to limit transmissions. People testing positive are no longer advised to isolate for 5 days. Free testing kits are now hard to come by, and soon people without insurance will no longer get coronavirus vaccines for free. All this is leading some to raise concerns about future preparedness. Ediz Tiyansan, CGTN, Los Angeles.